Hi, I'm Steve Rowe, CEO at Oak Knoll. I'm recording this video the afternoon of Thursday, January 4th, and it will be uploaded and available to you by sometime on Friday, January 5th. Happy New Year. I hope that you didn't spend as much time on your holiday as I spent watching Iowa football. That was painful, and we're just happy that the season is over now. Our COVID numbers continue to be higher than we would like, but they are starting to come down. I think we peaked at 11 or 12 COVID positive residents sometime late last week or over the weekend, but people have been coming out of their quarantine period, and as of today, we are at 8 COVID positive residents. We also have 5 employees who are out of work right now because of a positive COVID test. We have had a couple of employees come back a little bit earlier than anticipated because they were symptom-free and had been testing negative. So that's a good thing that nobody was super sick, and people are coming back to work. We do anticipate that those numbers will continue to decrease as we get further away from the holidays. Just a reminder that our staff anyway, are wearing masks in the health center and in assisted living. Kim talked a little bit about that last week, that if the numbers continue to increase, we may consider going back to masks throughout the entire community for our staff. We have not needed to do that yet, and I'm hopeful that we won't as the numbers continue to decline. But if we get a spike, that is certainly still on the table. Some of you might be aware that we were at the City Council meeting this past Tuesday with our rezoning request for 1201 West Benton. That is the property that ideally we would like to build a small house model of nursing home care that would house 12 residents and would have common areas like a common kitchen, living room space, dining space, activity space, all of that in one nice modern looking building across the street from Oak Knoll. The City Council for rezoning requests, typically there are 3 considerations of a request. The first consideration was this past Tuesday, January 2nd. Kim Bergen-Jackson and I, along with our architect, were there. And I'm happy to tell you that there were no objections voiced during the public hearing portion of that meeting. And the City Council, in their discussions of our request, they were very complimentary of Oak Knoll and the design that they saw for this proposed new building. It did get approved for the first consideration with a 6-0 vote. There is one council member who recused himself. He works for the architectural firm that designed the building for us, so it wasn't appropriate for him to be part of the conversation. But it did pass 6-0. That means that it will go on for a second and third consideration, and it's possible that those two considerations will be collapsed into the January 16th meeting. So we're hopeful that after January 16th, we will have obtained the City Council approval that we need to have for the rezoning request. So another step along the path of trying to make this happen. If it is successfully approved at the City Council level, then we need to go to the state of Iowa to get approval and permission to build 12 additional licensed nursing beds. You might also recall that the state implemented a moratorium on new nursing beds effective July 1st of last year. And currently there is not a waiver process to obtain new nursing beds. So we are working with Bill Boyd. He's an attorney out of Des Moines who helped us the last time that we increased the number of nursing beds at Oak Knoll. That was shortly after the spring building opened, and we added 10 spaces to make way for our short stay unit. So we have experience going through this process. We're cautiously optimistic that we can paint a compelling picture of the need for Oak Knoll for these additional beds, that it really doesn't impact anyone else, and that reasonable people who are listening to the request will approve it. So we will just keep marching forward until somebody says no, but the plan is to continue to make that small house nursing home come true, and just another step along the way here. So we'll keep you updated with City Council after that January 16th meeting. I think that's it for that. I want to provide a business update just briefly, since we're halfway through our fiscal year. As of today, we are currently at 51% of our full year entrance fee sales goal. So signing new Life Care contracts, we're just over the halfway mark, which is pretty much right on pace for where we should be halfway through the fiscal year. So that's good. We currently only have one apartment in independent living that's available, and I feel like we're probably 2 to 4 days away from having a match for that apartment. It's a good space that's like somebody is going to take relatively quickly, and we have an offer out right now to a household who is seriously considering it. We continue to have 4 open apartments in assisted living, with one of them accounted for with a planned transition that will happen sometime over the next month to a month and a half. So one of those 4 apartments is spoken for, but there are still 3 open assisted living apartments. And then finally, the census in our health center, as of today, we're at 52 out of the 58 spaces that are occupied. We do have a couple of independent living residents who fell recently and sustained injuries, are in the hospital now, and over the next week or so will be discharged to our short stay unit. So we'll be a little more full than we would ideally like to have, but we still have capacity to care for the people who will need that additional nursing care and therapy to recover from their injuries and be able to go home. I think that's it from a business update. We also continue to have lots of people who are interested in learning about Oak Knoll. Almost every day, you probably see either Retha Haas or me doing a tour with prospective residents throughout the Oak Knoll community. It seems to be more than a daily occurrence that we've got prospective resident appointments. There are currently 276 households on our wait list. So as we walk them through, talk through the application and admissions process, ultimately what they're doing is getting onto the wait list, and that list continues to grow, and we're currently at 276 households who have paid a small deposit and have indicated that at some point in the future they would like to become Oak Knoll residents as well. So all is good, things are going in the right direction, and we will keep you updated with progress as it occurs. That's all I have for you today. Hope you're doing well, and we'll talk with you again in a couple weeks. Take care.